HIPcast is brought to you by Enterprise Social Record.
I am so excited. So if you listen to the show and you saw Seth and I do the 2025 recap, you saw that kind of at the end. Well, at the beginning, we gave a little teaser that HIPcast was growing. And then we said at the end, again, HIPcast is growing, to stick around, come back and watch another episode to see what's up. Well, we are growing, and that's what today's episode is about. We are so excited to walk through what's going to happen. Seth and I will continue to do our podcast that we do, but in addition to that, we are adding. And so I want to make sure that you know that HIPcast will stay the same for Seth and I. We will still be doing what we do, but we are adding someone to the every other week. And in case you can't tell, they're kind of on the screen with us. I'm so excited. Seth, are you thrilled?
I'm absolutely thrilled. So, like you say, we're adding a second show to the HIPcast world and channel, and it will be a lot of fun, like you say, on the other weeks that we don't post. You know, Shannan and I typically do the interview type styles, and we would like to highlight professionals from all walks of life and all around the world. And we're going to take a different approach with the second show. So that's the introduction. I guess we don't do introductions well anymore. I think we do them better.
We do them much better. I think they're much better than they used to be. What do you mean?
It's not. It's a weird. It's not an introduction in the sense of it's like, hey, you're on the show. You're the expert. We want you to tell us about your journey. So I guess we'll start there. And Lorie Mills and Kristen Borth are with us. And what we're announcing here is that we're adding a second show called Primo Perspective. Now, that is very difficult for a Tennessean to spell, so I needed the help from Mississippi and from Kristen to help me get that spelled out correctly. But so we'll start with you guys to introduce yourselves and tell the audience about who you are, sort of your HI journey in a shortened fashion. And then let's go into what is Primo Perspectives. And Kristen, you'll start, and then we'll go to Lorie, who, for those in the audience, I call Mississippi. I struggled to call her Lorie. I've called her Mississippi since I met her 1,000 years ago. So if you hear the term Mississippi, that's me talking to Lorie. So, all right, Kristen, turn it over to you to introduce yourself.
Perfect. I am so excited about this. So my name is Kristen Borth. I've been in the HI profession for almost 15 years. I have enjoyed all walks of settings except one. I've never been in veterinary settings, and I don't plan to go there. So I have a lot of various experience in consulting specifically and teaching. And I'm just excited to learn from Lorie and make the HI profession a little bit lighter, because I feel like sometimes it gets so heavy, and just get to learn about it a little bit more.
Absolutely. Lorie, tell us about yourself.
All right, so my name is Lorie Mills, and this is my 32nd year starting in HIM. So I've been around for a long time. I've worked in small acute care facilities. I've worked in a large hospital system where I was the director of coding and CDI. Love revenue cycle. And provider education is probably one of my favorite things to do. And people say that there's something wrong with me because I enjoy that it's okay. Kristen and I work together, and I love being on a team that we have so much fun. And that's what we want to bring to our podcast, is a lot of fun, a lot of information, and just, keep everybody informed.
Yeah.
Now, primo, you said when we were first talking about this idea, is like an Italian word, right? Primo is like new. Is that correct?
Best.
So,
yes.
Okay. So
first class, Seth. Primo. First
class. Now, yes. Okay. Now we're talking first class. I'm into first class. So I get that. So Primo Perspectives. So tell us, what is the general idea for Primo Perspective? We talked about how Shannan and I like to do interviews, but it sounds like you guys want to talk more topic specifics, right?
Yeah, definitely. We want to talk about hot topics, things that are kind of rolling out. If you've not really been paying attention, it feels like healthcare is really accelerated with a lot of its changes. And, the new administration, which I don't know if you can still call it new when it's been in there for a year, but this administration has rolled out a lot of changes and a lot of executive orders that directly impact us. And so we wanted to kind of elevate our discussions around those so that they're informed, but also they're helping to ground us and give us a really clear path forward. So we can talk about some of the pitfalls that we might have, or some of the things that are going on with these new executive orders or new hot topics that are coming out that are happening in healthcare. And as we do that, hopefully we will get that primo or top tier perspective on what we should do and how people should move forward, or could move forward, or maybe not move forward at all because we're stuck. Who knows? It'll be fun to explore it. So yeah, just kind of dive in there wherever we can.
That's great.
It. And for those that are watching on YouTube, you may see that Mississippi just dropped off the recording here, so we're gonna have to get her some Starlink internet or something by the time we get recording.
Right? Can't be leaving me hanging. No one's gonna want to hear me talk by myself.
She'll be back. I feel confident in that. So, you know how Seth and I are very much about, this is for the listeners, Seth and I are very much about networking. We talk about networking all the time, and volunteering, and just making those connections, and building relationships. And so this discussion that we're having about Primo podcast coming as part of the HIPcast channel, this discussion has been happening for a long time. And so Seth and I have been doing this for about 2 years, the show here, the podcast. And then we've been talking with Kristen for over a year, I think, about adding this channel. And so we've been, all four of us, you know, kind of collectively have been working through, talking through the different, you know, what do you want to do? What do you want that to look like? When do you want to get started? How do you want to get started? That kind of thing. But I do want to say to students that might be listening, I'm trying to do better like Seth and talk to our students. Seth is constantly talking about how to, as a student or a new graduate, take that job. Just take the job to get in the place. Just take the job, right?
Yeah.
But also, whether you're new to the profession or you've been here for a long time, it's important to network. And so because of our networking, our paths just keep getting deeper and deeper intertwined. And so with Kristen and Lorie, I've done several things over the year. Lorie constantly speaks for different associations, but she's been part of the THIMA family for a long time. They come together and present. They happen to work at the same company. They come together and present. So the networking has been phenomenal. We couldn't think of anybody else to add to this show, to our second channel, that would be so well versed in so many topics across the impact of our domains in our profession. So we're so excited. And speaking of those domains, what do you think some of the topics, Kristen and Lorie, what do you think some of those topics are going to be that you cover besides just the hot topics?
Yeah. So I know for me, my passion lies in compliance, regulatory compliance, and that spans, you know, to AI, all of those different areas. And then I have a interesting background with being on the state consulting side. So I have a regulatory governance, just those nitty gritty, really, really dull topics that I think they're just really interesting, because as you dig into them and you start working through them, you're like, oh, this is really not that dull. It's just dull to read. So I like those. And Lorie's going to take me down a path that I have not gotten into as much. So Lorie, you tell us the topics we're going to talk about.
Yeah, and I'm going to have fun taking her down that path. I like to lead people astray occasionally. But we're going to really dive into your revenue cycle, discuss the world of insurance. What's going on in the world of insurance with healthcare providers now? You know, how are we navigating that? And not only that, but also our patients. You know, how do we handle our patients' billing calls, questions, concerns, things like that? You know, how do we interact? How do we teach physicians to document appropriately so we can support the care that we're actually giving our patients. That's the kind of things we're going to talk about, and I think we're going to have some fun while we do this.
Yeah.
Yeah, I like the topic piece because it's different than what Shannan and I typically do, where we're trying to highlight a professional or we're trying to highlight something specific around a professional or the profession. But you guys are going to really talk about what's going on today and what is happening in the profession, what is happening in the marketplace that listeners that are listening to the audio side or watching on YouTube can sort of check in and see, all right, am I dealing with this at my health system or at my veterinary practice? I didn't even think about the veterinary practices and medical records, but it's a very good point. So it's going to be a little bit different because you're actually going through the hot topics and it's things that they can listen to and say, all right, yeah, I'm dealing with that. Oh, that's a strategy to deal with that, or reach out from there. So I really like the concept of bringing those ideas to fruition. Now, you're going to do compliance and those type things, and Mississippi's going to do a lot of revenue cycle. Any other items out there that you think that you're going to hit in the middle of this that you may bring a guest on or whatnot? Any of those type things that pop in the brain?
Oh, sure. There's one thing I want Kristen to do, because we are hearing so much about AI, and that's great. I know what AI is, but I need somebody to teach me how to use AI. How do I teach it the prompts? How do I know what to ask, what to do? So she just doesn't know it yet, but I'm going to get her to let's do that. She can teach me how to do that on one of our shows.
That's awesome.
Yeah, I'm glad you brought that up, like teaching with AI and stuff, because it is so unique. I got to sit in a really interesting session at ChiaCon, and I was sitting in there listening to them teach people how to prompt ChatGPT. And I don't know if I just didn't think about it or if I was just, in the school of hard knocks and like, well, that didn't work. That gave me crap. What am I doing with this? And asking more questions and just pushing it a little bit further, to explore it. But when I was sitting in there listening to her tell people how to give prompts, I was like, that's a really great idea. People need to know how to give prompts. So, I do think that Hot Topics will cover some things that aren't just within the compliance realm or within the revenue cycle realm. We probably will have some things that come up like school. I teach, and so seeing what's happening with our schools, seeing that we've got schools closing down their HIT, HIM departments because they don't have enough students. Those are still hot topics to me that really impact our profession. So I do think there's going to be something for everyone throughout the year. It'll just depend on what episodes you catch and what we're talking about, because what's the big thing that's happening that we caught that week or whatever.
Oh, yeah. One thing I want to talk about is leadership. How to grow as a leader. A lot of times we have students that'll come in for their practicum and they'll be like, okay, how do I get where you're at? I want to be the boss. I want to be this. Well, there's a lot of work that goes into that. And we want to tell people, you have to invest in yourself in order to get in those positions. Don't just think that it's going to be handed to you because you have a degree or you're straight out of school.
Right.
We want to make sure that people are growing and knowing what's going on in the industry.
Yeah.
Lorie, I wanted to ask you, I know some of the things that you and I have really got to work on together this year, in the last part of this year. Several challenges have been identified, some of that with an EMR system. Maybe it's staffing maybe not having a particular role staffed correctly or whatever it is. One of the things that comes to mind is, kind of peripheral to your revenue cycle topics or comments show that you're going to do. Quality reporting is a big thorn in so many sides. In providers, physicians, hospitals, but also in the payer world, the quality reporting is a pretty big deal. I'd love to see if you could cover something related to, are you all thinking about covering some like known issues with particular EMRs or some challenges to quality reporting that you maybe have been able to solution that could help other folks? Or those topics you all think about covering?
So I kind of feel like I will cover anything that there is a need for. So, I would love for our listeners to send in requests. Hey, we want to talk about this topic, or, what do you know about this? So I think the answer to your question is a simple yes, we'll talk about that. But I want to make sure that we're meeting the needs of everyone. So I would love feedback from people to tell us, hey, this is what we want to see you guys discuss and hear about.
It's awesome.
Yeah,
Yeah.
like that. And Kristen's the organizer of the group. We'll say that. So, like, Kristen and I lean to the more we want to plan, we want an outline. We're going to point. I point Shannon in a direction. Kristen's going to point Mississippi in a direction, and then just go. So, it's a good balance between everything, and I think it's going to be a great show. I'm looking forward to seeing when the first few topics are scheduled to record and when they come out. Do we want to talk about that? I think February is when we're going to announce, or when the first shows will release. So that's exciting. So that's coming very soon, because this episode's posting on January 12th. So just in a few weeks, you're going to start seeing the Primo Perspective on the HIPcast channels. And I will mention, one thing that a lot of people ask is, are you guys trying to get famous? No, Shannon and I are already as famous as we want to be. So the HIPcast product is to the benefit of the THIMA Foundation, which any sponsorship dollars goes towards scholarships for HIM students and education of the HI profession. That's fantastic. So if you think about this, we're all volunteering time to talk about what we do, how we do it, but the intent is to educate those that are coming up, to engage the HI community that's already there, and to bring those dollars into the foundation for the betterment of the profession. That's exciting to me, just because, hey, we're here to better the HI profession.
Yeah, there's nothing.
Go ahead, Kristen.
Oh no, I said there's nothing better than lifting it up. So I think it's great.
And I think the one thing that, because we're old in the field now, I'll say that, or experienced HIMers at this point. I know when I came in, there wasn't as much interaction with the more experienced HIMers and the younger ones. I mean, it was hard to get mentored. And I think it's important that we have identified that and are trying to rectify it. We want to make sure that we're helping the people that's new into the field, that they grow and they understand, what's going on and how do I become better at what I'm doing? What does things mean? How have things evolved? One thing, we don't need to forget our past, because it'll make you have failures in the future. So I think we definitely need to have those conversations.
Yeah.
Well, you mentioned the things have evolved. It's the profession itself, or I say young people nowadays because I'm getting old.
I never thought the day would get here, but it finally got here in 2025. Seth started saying he was old. I was like, he's with us now.
So, yeah, I'm finally seeing these young people now that I look at it. But it's like, the younger folks that are coming into the profession and the students that are coming out, they consume information much differently than we did when we were in school. And so when you talk about like that mentor piece is, like I used to want to go and find the person to follow and to job shadow, to, hey, let me spend a couple days or a week with you here to see what you do so I can understand if that's a path that I want to go. That's hard to do in this day and age. Here I go again. Because, people are working virtually. Things are just totally different. People are spread out all across the country now. So a lot of the younger people in the world now are having to consume information differently. So that's where a podcast platform, I think, will help in many ways for folks to, it may not be the mentorship that we had when we were students in HIM school, but it could be that they learn quite a bit of, all right, maybe I want to go down this path. Maybe I do want to go into the dull world of compliance and read those type things.
Exactly.
It's not dull, not at all.
Is it not?
No.
Kristen, you tell us. Is it?
Perspective, it totally can be, but the Primo Perspective says it's not.
Yeah.
Well, Seth, to your point too, Kristen is a program director, and we haven't even talked about what Kristen and Lorie do except for compliance and RevCycle, but they are a dynamic duo leading a company that's been around for a long time. And so we can talk a little bit about that. But I will also say, even the clinical the practicums that students in our field have to do now, probably not just in our field, but in every field. Practicums are hard, where we used to go physically and file papers or work through, ticking off reports or whatever it was we were doing when we were doing our practicums in HIM world. For now, it's very different. And Kristen, as a program director, she did something very different this year, where the practicum was completely remote, and all of our team worked synchronously and asynchronously with a leader that was giving them assignments on how to do things. And they were they were working in a software program. So even their practicums are different. So as part of that mentorship, you don't even get to go into the physical place and follow. There was some natural mentorship that happened, like that one-on-one connection, if you were going into a physical place. And now that's a lot different too.
Yeah,
it really is.
Very true.
Yeah, I didn't know that you were doing the remote practicums. That's pretty fascinating. It's something that you assume that's the way it's going, right? Everything's heading that direction. So
yeah, we've been trying to do more remote practicums. We started in 2019 doing a few, and 2020 really gave us more power to do more remote practicums, just because we had to. But we've got to define them and really work through some of the glitches in them. And I think I truly think students are still getting a really valuable, really powerful experience by going through these remote practicums. I keep hearing the more seasoned than myself, and then most of us on the call say, oh, well, I don't think that that's possible. And I cannot help but disagree, because I see my students coming out, and as they're coming out, they're able to talk and able to communicate. They haven't been in the hospital setting, so that's different, but they are able to step into a role and understand what's happening and the dynamics that are happening. And I think that's the most valuable part of a practicum, not just being in a hospital. Anyone can be in a hospital. Let's be honest. Anyone can be in a hospital and get the feel of the hospital. It's knowing the actual workflows.
And speaking the language. I mean, we speak a different language in healthcare.
You do.
Just learning the acronyms is a massive obstacle for a lot of folks.
And Seth, you bring up talking about speaking a different language. Not only do we speak a different language in healthcare, there are subsidiaries in healthcare that we speak different languages. Clinical and non-clinical people do not speak the same language at all.
What?
Very true.
Are you serious?
So, and that's always been fun for me, because I've been in positions to where I do speak both sides. And so learning that has been invaluable for my career, actually. It helps me understand both sides of the situation.
So there's a business idea for you. We'll create the Duolingo version for healthcare.
That's funny.
There you go.
Yeah, I have a slide in one of my presentations I use quite a bit that talks about the perception of clinical people, of financial people, is that their financial folks are bean counters, and they're wanting to take every little bean and account for it. Whereas our clinical people, they're standing there with $100 bills, just raining them down and spending them. And in reality, it's not that way. It's not really that way. We all have specific jobs, and but we have to come to understand that the clinical folks really want to take care of their patients, and that should be financial people's utmost goal, is to make sure we're providing great health care. And so we have the same goal. It's just we get to it at different ways.
Yeah, absolutely. So what excites you about the HI profession for 2026 and beyond? So that leads you into this new podcast channel for HIPcast. What gets you guys going here with our profession?
Lorie, you go first.
Oh, yeah, thanks, Kristen. I just think, because I've been in so long, and we're evolving, and we've evolved a lot in the last 30 years. But in the last 2 years, we have evolved at a tremendous pace. And so I'm excited to see where do we end up and or get to in the next year. Everybody's talking about AI, and there's so much that AI is going to be able to do. How fast are we going to progress in the next year or two? If we've moved this fast in the last 2 years, it's going to be interesting to see.
Yeah.
Kristen?
So okay, I'm gonna use a term that's gonna sound a little bit doom and gloom, but it's not. I do think that healthcare is on the cusp of a reckoning, and I am here for it. I am excited about it because I think that what's going to come out of it is going to be better. I think what we're going to see is some improvements to things that have been broken for a really long time and need to be fixed. And so I think AI is a component of that, and AI has a lot of the promises that we would like to see for more efficiencies and more effective diagnosing, communicating, documenting, all of these things that I think it kind of has a promise for, but I don't think it's the ultimate. I think the ultimate is going to be how we integrate some of the new technology and how that new technology might transform roles. And we have been top heavy in healthcare for way too long. I say that as somebody who is on the top side, right? Like, you're on the healthcare top side. We're not the clinicians out on the floor. So I am saying that carefully, but I do see where we've been so top heavy. And as we start to streamline and realize that reckoning that is coming, that it is going to change up and shake up healthcare, I think that's going to be the really exciting part. And so it might not happen this year, but I do see that it's coming. I've been hearing so many directors get, laid off just in the last 2-3 weeks. And it's across the board. They're moving them to the manager and, taking away that director position, because a true director, if I'm being brutally honest and very blunt, a true director, if you have a good manager, you can get by with doing bare minimum because your manager is going to be doing it all. So I just think we've got some really powerful things that are kind of coming down, but we have to figure out how to streamline them, but also make them move towards the better part, move positive. And I think it's there.
You answered that like a true compliance nerd.
Yep.
I know.
Reckoning is coming, and I'm so excited, and I'm here for it.
I know. I see. Yep. Okay. I'm just saying.
I love it.
And for Shannan, but everybody else too, this is going to be completely unscripted. So you're hearing real life Kristen, talk, Lorie talk when we're talking. It's going to be really what we think is coming, and the words might not sound great all the time, but it's definitely what I think is going to push us to, be honest and be better, especially when it comes to healthcare, because we don't like to dig into that side. It's like we want to keep everything copacetic.
Yeah, Kristen, I love that you said a reckoning is coming and that you're excited for it. Things are going to get better. It's going to force things to be better. What I take from that is truly how I feel. We have the opportunity as a profession to shine like never before.
Oh,
like truly. We have, if people now we've known for as long as we've been in this field, in this industry, we've known that data is an asset, and we've known that the context and the content of that data, and their stewards, we know that's an asset, right? Yeah. Well, now is the time for us to shine by helping the industry move forward with the appropriate governance, the appropriate processing of things, the appropriate updating and maintenance of that data that exists in those systems. And so if you're excited about the reckoning of this is going to force things to be better because we have to understand every bit of the data that's in this particular life cycle of a patient, then I agree with you. And it is exciting for our profession. Yes. We do have a chance to shine like we have never shined before. Like shown before. I know, shown, whatever. I the South, it's fine. But we do have, so I think it's exciting too. Seth, what you got? What are you excited about?
Well, now I'm excited about a reckoning because it's due. I mean, it is absolutely due. You know, it's as you were going through some of that, you're talking about how we're top heavy in healthcare, and I believe you're speaking in a general term across all of healthcare, not just HIM, but
Right.
in healthcare overall. And my mind went to a conversation I had with my 11-year-old, and then it goes back to when I was in school and first came out of school and started volunteering with THIMA. And the push back then was, how do we get ourselves from the director to the chief of health information? And I always wondered at that time, I'm like, should we be the chief health information? Do we need that chief see something title? And that was the big push back then, was the see something title. And then quickly it followed where many of the baccalaureate programs started going to masters only. And it made me think of a conversation with my 11-year-old where she's kind of interested in physical therapy, but she's like, I don't want to go all the way to get a doctorate. That's like 7-8 years of school to be a physical therapist. Or it's a PTA is the other option, which is a 2-year degree. There's no middle ground anymore for folks that want to be in it but don't want to spend 8 years of their life getting education and then turn around and go, maybe I don't want to do this. Now they're $200,000 in debt. That's a problem in the country for many professions. But I think you're spot on. There is a reckoning coming to where we're going to have to adjust things back. To be able to give an opportunity for, again, I'm going to sound old, the young folks, to give them an opportunity to succeed.
Yeah.
How did you go all Eeyore? I said, what's exciting? And here we are.
It's a talent. It's a talent.
So, and Seth, it's interesting that you talk about that because we've all been in HOD together and we've heard some conversations of, you know, master's degree should be our base degree and things like that. And several of you guys in Tennessee have doctorates. And I told them, I said, I'm kind of intimidated when I go to Tennessee because there's so many of you guys that are doctors in Tennessee. And I have an associate's degree. And so I just think that that's funny. You know, when you look at, I have an associate's degree, but I've made it further than a lot of people with a master's degree. And I think that even though education is important, it's not the one all be all. Just because you have the education doesn't mean you know what to do with it or can do anything with it. And I think we forget that. And you're talking about pushing younger people for those advanced degrees, and it costs so much money. Depending on where you're at, sometimes it just takes hard work to get there.
Yeah, education is not an entitlement to some C-level job or some director, right? Education is not the entitlement for that. You have to have the experience. And Lorie, I think it's fun. It's true. Peer pressure among the Tennessee Health Information Group is strong.
Oh, yeah.
People,
in your education.
We're pushing people like we are big pushers. That's true. But Lorie, I would tell you and anybody listening that the only person in Tennessee in our, like if I'm thinking about who consistently volunteers, Melissa Kohler may be the only doctor in Tennessee who wouldn't be intimidated to have a revenue discussion or debate with you. I would never say yes to a debate on revenue cycle with Lorie Mills. Like I'd be like, nope. So yeah. You definitely, you and Melissa, I've said many times, you and Melissa, I'm like, revenue cycle, I got to call phone a friend.
I do want to mention, we talked about the benefit of HIPcast goes to scholarships, and yes, that goes to students that are in RHIT and RHIA programs, but we also have what's called the Tony Taylor Scholarship. And Tony Taylor was a member of THIMA that pushed his teams and other people within the profession to get a credential. It doesn't matter which credential it is. It could be just the first one that you think is interesting that you just need to study for a test on and then go take the test. Yeah. And so we have a scholarship in the state of Tennessee, Tony Taylor Memorial Scholarship, where it is dedicated to those that just want to get a credential. And we pay their credentialing fee to be able to do that. I mean, I think the reckoning, Shannan, to go back to what you said of I went gloomy with the Eeyore, but the reckoning is going to be so valuable because what what this profession allows is an entry point for folks to get just a credential. You don't necessarily have to have an associate's degree or a baccalaureate degree or a master's or a doctorate. You can just start at the beginning with getting a credential and working your way from there. And if you want to get more education, you can. If you don't want to get more education, you don't have to. You can find your pathway in this profession. So I think Primo Perspective is going to be a lot of fun. It's going to be a lot of hot topics. We're going to start recording here soon and then posting in February. So stay tuned. We're going to keep it all in the HIPcast channel, and that way it makes it easy for folks to find. And we hope to see it grow. Kristen, Lorie, thank you for being here with us. We're excited to have. I know, Lorie. It sounds weird to say Lorie.
I can't wait.
So it's going to be fun. We're going to start recording, and that's going to be a great time. So, other than that, I don't have another closing other than the 26th is going to be a fascinating, fun year. And we're at the precipice of a reckoning. That sounds fun. So I like the term. All right, Shannan, until next time, my friend.
See you next time, buddy.